Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And I'm going to talk about heart health today with our guest, but before we get to that, I'd like to give you a community update around COVID. As you can see from our slide, much of the country is in low transmission levels, which is great news for all of us. That's a 2-week difference from February 8th to February 24th on the slide. Our community levels for COVID in the state of New Hampshire are also almost entirely low. You can see Hillsborough County in the outline, and we have Stratford County is the one county in New Hampshire, not surprisingly bordering another state with a lot of yellow that has medium transmission. Want to remind folks to skip the flu, but not the flu vaccine. Flu is causing between 12 and 61,000 deaths each year, and healthy adults can affect people up to 7 days after becoming sick. You can miss up to 17 million work days were missed from the flu and 38 million school days. So please, please get your flu vaccine. It's not too late. And children and the COVID-19 vaccine. Children age 6 months and up are now eligible and have been for a while now for the COVID vaccine. If you need a booster for your child or need to finish the series, please go online and look at vaccines.gov and you can find a booster in your area. Most pharmacies are carrying them, or you can call us down at Public Health. And we also have COVID antigen tests. So if you have any suspicion that you might be having COVID in your organization, would like to have a stockpile of COVID antigen tests, please contact us at 603-589-4500, and we can supply you with some free antigen tests. And lastly, if you do come down with that positive diagnosis of COVID, Paxlovid is widely available to treat COVID-19. You can call 1-800-818-5803 and have a telehealth consultation to get your Paxlovid prescribed if you're not able to talk to your provider. And now, what we've all been waiting for. Welcome, Dr. Richard Hayes from Dartmouth.
Thank you.
A cardiologist with Dartmouth. And we're here to talk about Heart Month, which is something we want to recognize at the end of this month, but really all year long, because we want to have good heart health.
Exactly.
So we thank you for joining us. So just first and foremost, just tell me a little bit about yourself.
So I'm a general cardiologist, meaning I do see regular old patients and do testing. I'm from New York originally and moved up to Dartmouth, Nashua about 6 years ago. And it's a great place to work. Oh,
well, that's good to know. So, so it is Heart Month, and we want to talk about that because there's just so much, heart disease is the #1 killer, and killer is a strong word, but it is it's the leading cause of death in the United States, in New Hampshire, among all ethnic groups, is the #1 cause of death. So very, very important for people to understand how, what we can do to prevent it, to recognize signs and symptoms and things like that. So I guess we could start with like types of heart disease, because there seem to be a lot of different things. We typically think of like the heart attack, but there's so much more to it than that. So can you start like explaining some like coronary artery disease, for example?
Actually, just so you know, New Hampshire actually now cancer is higher risk, higher death rate than heart disease.
Oh.
They're always back and forth, but they're by, I think it's 60 deaths or something.
Okay. So New Hampshire has
been
unique
its own special
yet again.
things. Yeah. So there are different types of heart disease. The major one that we talk about in prevention and #1 heart disease in the U.S. is coronary disease, which means that there's plaque buildup in the arteries, and sometimes if there's a blockage that's severe enough, you can get a heart attack, or you can have just chest discomfort.
Okay.
And that's one of the symptoms of coronary artery disease. Is in both men and women, is the most common symptom is actually chest discomfort.
Chest discomfort, like a tightening?
A tightness, yeah. So people say chest pain, but it's actually, as you described it, it's more of a pressure.
Okay.
And it can be anywhere from the ears to the belly button, actually.
Oh, so that's a long area.
That's a long area.
I mean, it is, because you
Yeah.
think typically your heart's in your chest, but it could be like belly pain or any of those kind of things, too.
Exactly. And people sometimes have shoulder pain or, neck pain, and they were at a chiropractor, for instance. That sometimes happens, or even tooth pain, believe it or not. So, but the most common thing that we think about in terms of chest discomfort is when people walk or do some sort of exercise, or with anxiety, for instance.
Okay.
And it gets better when they stop doing what they're doing, walking, typically.
Okay.
And it's mid-sternal pressure, basically.
So these are like, you're doing kind of basic activities, though. You're not doing
Yes.
anything very difficult or strenuous. I mean,
Well, sometimes it's, people present with chest discomfort after doing a marathon, if they're, marathon runner. But it's more concerning if it's on shorter distances or at rest. And it's often associated with other symptoms. I think you were talking about men, and we were talking about men and women before we started.
Right.
And women actually still have chest discomfort as the most common symptom, but they also have other symptoms
Okay.
that sometimes are more common than in men, like shortness of breath or nausea, stomach pain.
yeah. So just presents a little bit different.
little bit, yeah.
It can, at least.
Yes, and
Yeah.
in elderly, actually, sometimes we see just people who get very dizzy and pass out. That's a common one that's we don't think about as much.
Oh, interesting.
Yeah.
So, and then there's heart failure. Is that the same kind of
Heart failure
symptom?
is basically, and I hate the word heart failure because you talk to patients and they think that
It's the end.
their heart's failing. But it's really congestive heart disease is sort of
Okay.
the better way to put it. But there's two different types of heart failure. One is where the heart is pumping, the heart pump is normal, and that's called heart failure with a preserved ejection fraction.
Okay.
And that's more common in women, for instance.
Okay.
That's more in the elderly. And then there's with a reduced ejection fraction, which just means the heart doesn't pump quite so well. And that basically means things like fluid backing up in the lungs and causing shortness of breath. That's a typical symptom.
Okay, so that fluid backing up causes that
Right,
shortness
and
of breath.
you can get swelling in the legs, lack of appetite, pain in
Okay.
the stomach.
So it's like, is that edema? Is
It's
that what they-
edema, exactly
okay.
right, yes.
So I just play a doctor on TV. No,
No, you're absolutely right. It's,
yeah, okay.
if you think if you
That
get swelling in the
the big
legs or you
ankles,
get
yeah.
shortness of breath, again, when you're exercising, sometimes when you're lying down, those are the kind of things that, make you wonder about heart failure.
Okay. And then can you explain what angina is? Or is that
So angina was originally described by the person who first coined the term is actually choking. So angina means basically that you're not getting enough blood to the heart arteries, and it's again pressure in the chest. So that's what angina is.
So is that caused by the blockages as well?
yes,
Or is it just-
exactly.
okay, I see. And then, there's the whole idea of stroke too, because we're often
Right.
lumped together. So can you just describe that for us and maybe some of the
Sure,
signs and symptoms?
sure.
Because those are very different.
That's very important, and stroke is obviously a very important cause of mortality and morbidity. Typically, people will have slurring of speech, maybe weakness on one side of their body that's occurs out of nowhere. And in that situation, it's very important to contact somebody right away, because the sooner you do, the more likely they are to have recovery of function, either with a clot buster medicine that they give in the emergency room, or even now they have techniques to get the clot out of the artery in the neck.
Right. So you want to get them.
You want to
and
get
what
them
are
to
some
the
of those
ER very-
symptoms, like that slurring?
The slurring of speech may be weakness on one particular part of the body, drooping of the mouth
Okay.
or eye.
Yeah, because that's often something that the person who's having the stroke may not recognize. But if you're with a loved one and something's
Yes.
happening, you want to be able to recognize those signs and symptoms so that you can get the proper medical attention. Like you said, time is
Absolutely.
really of the essence for stroke.
Yes.
As I would
and
imagine,
it's for heart
attack
disease
too.
as well. And most of the patients who collapse or have sudden death are in their house. So, and the family member just doesn't know how to do CPR.
Yeah.
So,
And I think we've made some progress as far as out in public. So you see a lot more of like the defibrillators available in public spaces so that you can do that if need be. And it's a pretty, I don't want to say easy course, but it's a pretty easy course to take. I'm going to say it because it's all automated, and you can the voice tells you what to do, and so in that case, you know, really anyone can come to assistance if need be.
Right, and that's absolutely true. I mean, the one thing I'll say is that only about 20% of people are CPR certified. So it's very important to learn how to do it because you can save lives.
Yeah, absolutely.
Absolutely save lives, and it's very easy to do. It used to be that you'd have to give rescue breaths, for instance,
Yeah.
and people were always worried about getting, you know, an infection or.
Sure.
So now it's actually considered chest compression only. So you get enough oxygen to the brain just from chest compressions.
Right, and I noticed that a few years ago, even prior, there was a health fair. I was in a different job, but they were teaching that as well, and they were like, "Wait, there's no more mouth to mouth. There's no more." It was just we learned how to do the chest compressions on the mannequin.
And it's you know, obviously very quick, very important to move quickly, activating emergency response. Part of the CPR course is actually involves using the automatic external defibrillator, as you put it, and that's it's a child could do it basically.
Right. You just have to be willing to
Right.
to do it. And we saw a great example, not to be too, well, it's current events, but we saw that great example from my own hometown, from the Buffalo Bills. When DeMar Hamlin went down on the field, the immediate response was, you know, to get him that help.
Exactly.
To restart his heart.
Right.
So
right.
that was like an incredible moment. And they gave a lot of credit to those people, the medics that came right on and used those. And like you said, it's very easy to use. And it's not a long training. So
No, it's very quick.
We want to encourage people.
Yes, absolutely. And you know, that's a whole other topic about, you know, where should we teach CPR? Should it be in schools? Should it be in gyms? Should it, you know,
Right.
from a community perspective?
Yeah, we can have you back on. We can cover that another time.
Yes.
So risk factors for heart disease. So we've mentioned a few. Well, actually, let's talk about them all because we have high blood pressure.
So high blood pressure, diabetes, hyperlipidemia or cholesterol, family history, smoking, obesity, lack of exercise, and the new one is actually sleep.
Okay, now I need to know about that.
Yeah, sleep is extremely important in terms of heart health. So getting a good night's sleep, making sure you don't have sleep apnea, which is when the airway obstructs. Typically, people will complain about snoring, or their wife or husband would say that they're snoring, and they stop breathing temporarily. They're sleepy during the day, and it's more common in obese people, for instance. But that can lead to heart attacks. It can lead to high blood pressure. And it's more common in obese people, as I said.
Wow. So you've really got my attention on the sleeping. Is there an amount, is it just good quality sleep, or is there an amount of sleep that you should be getting a night?
Yes, I mean, good quality
protective?
sleep.
It
You know,
sounds
it
like more the
depends on the
quality.
person, but probably over 6 hours was good.
Oh, that's
Not
good.
not the amount of sleep that doctors get. Try to, as a good rule of thumb.
Right.
Doctors get too little sleep.
Do not use you as a role model.
Exactly.
Don't use me as a role model either. So sleep, and then high blood pressure. Why do we want that under control? Can you just
Yeah,
describe the
so everybody
physiology?
should know what their blood pressure is. Extremely important. Most people don't know. About half of people, I think it is, with high blood pressure have no idea that they have high blood pressure, either because they don't go to doctors or whatnot. So high blood pressure is basically an elevated blood pressure, which is measured in a doctor's office with a sphygmomanometer, which is a cuff that's measured, and the numbers are generally anything over 130 over 80 millimeters of mercury systolic pressure over diastolic pressure is considered high blood pressure. In that situation, the first thing we want to do is, well, first of all, measure it again. But the most important thing in that situation, if it's only mildly elevated or stage 1, is lifestyle modification. And that's where salt reduction comes in. And it's very important as a doctor that we get histories of people in terms of salt. They say that they're not adding salt, but they're eating, you know, Chick-fil-A and pizza and Chinese
Processed
food.
food,
Exactly.
canned, because salt's a big preservative, so we see it in a lot of things.
Right. So you'll see people who stop eating salt if they can. They'll drop their blood pressure by 5-10 points.
Wow.
Yeah.
So that's very important. And then high cholesterol, and that's kind of the plaque that we're talking about.
So
That's a
cholesterol
buildup?
it builds up. It actually leads to the buildup of plaque. You should also, very important to know your numbers. Go to a doctor, get your cholesterol, know that the LDL is a bad or lousy LDL is the sort of way to think about it, and HDL is
Okay.
healthy, HDL, and then there's triglycerides as well. And basically, healthful diet, I recommend either the DASH diet or the Mediterranean diet as a good way to reduce your cholesterol. And you can get your cholesterol under control just with diet and exercise, about 10% reduction.
So the DASH diet that's a low sodium diet?
So the DASH diet is the Mediterranean diet that's low in salt.
Okay.
Yeah. So in the Mediterranean diet includes, as you can imagine, fish, chicken, vegetables, fruit, pulses like beans, grains, Greek yogurt, and the most important of all is extra virgin olive oil.
I'm feeling good about myself right now because I had yogurt for breakfast and we use
Yes.
olive oil.
Right.
So,
But extra virgin.
yes.
And don't cook
But of
it.
course.
Don't cook
it.
with the because it loses its benefits.
Oh.
So you just on a low heat. Don't cook. Just use it raw if you can. sort of thing.
Okay.
Yeah. Use it
Oh,
in your
I
salad
am learning here
dressing.
today.
Yeah.
That's great to know. That's a great tip because we do use it on our salads and that kind of thing, but often I do use it just to saute things.
And
as
you,
well.
you have to realize that obesity and overweight and obesity is pretty much it's an epidemic, as you know.
Yes, it is.
And something like 2/3 of our population is either obese or overweight. About a third are considered obese. And we figured this out based on what's called the body mass index.
BMI, yep.
Right, and that's basically, although it's a little controversial because some
Yes.
people, it's more fat, basically. But the bottom line is it should be under 25. If it's between 25 and 30, that's considered overweight, and if it's more than 30, that's obese. And obesity leads to diabetes, it leads to high blood pressure, sleep apnea, cholesterol abnormalities.
Right. And so we're just seeing a lot as a result of obesity, and that is on my list too, along with unhealthy diet and physical inactivity.
And
as a risk
it's all,
factor.
the one thing that people I don't think know so much is I personally believe that food is an addiction. It's as powerful an addiction as alcohol, really. You talk to people and they just can't stop eating. They won't stop having sweets, which has got high fructose corn syrup in it, which is extremely addictive. So it's very difficult for patients to diet, for instance.
And I like to rephrase that a little bit with diet. It's like, because it's something that I had, again, read under your description, it's like lifestyle. Because
Correct.
to me, and this is just like probably semantics, but diets are very hard to keep up.
Exactly.
But lifestyle changes, if you can start by changing one
Right.
thing at
Exactly
a time.
right. Yep.
And bite it off in, no pun intended, but bite it off in small pieces.
Right.
So that you're not just, that full deprivation, that full, kind of like, that's it, I'm done. I'm done with salt, I'm done with sugar, I'm done with, ideally we want to reduce those things. Because
Gradually, as you're saying,
that
yes.
reduction will increase your health.
And a lot of patients will say, that they failed, they can't, diet, or, it's almost about like they're shamed. Whereas, as you said, I really rarely use the term diet as opposed to lifestyle modification. And, because diets stop at some point, right? So people will say, I went on a diet and, I lost 20 pounds. And okay, now I can eat what I want,
And then that weight's going to come right back on.
Exactly. And as you lose weight, actually, it becomes harder to keep it off because what's called your basal metabolic rate is higher when you're obese. So the less you eat, you lose calories or lose weight quickly. But when you're lighter, your basal metabolic rate is lower. So even a little bit of calories will make you heavy. So the bottom line is that that's why people yo-yo in terms of their diet, is because it's very easy to get the weight back on. It's very hard to keep it off.
Right, right. And it is, I could be a study in that, but we won't go down that path because, you know, that is true. And as you age, it can also be harder to keep weight off. But again,
Right.
it's that lifestyle modification and paying attention. I also really appreciate that you said people say that they're a failure. I think this whole black and white thinking is very detrimental. So if there's ways we
Exactly.
can just think to make that small change, it doesn't have to be all one way all day long. Just, you know, give yourself some points for like making some small changes, and they will add up. And if you can stay with those changes, you know, eventually you're not going to miss all that salt. In fact, when you open up that can of soup and you try it, after, you know, decreasing it, you're going to notice it.
Right.
And it won't taste good to you. You will definitely notice the difference.
Yeah, and it's good that you mentioned foods, because there are processed foods have a lot of salt in them. And so people should be aware of the salt content. It's right on the label that it tells you the amount of sodium, and people should have less than 2.3 grams of salt a day. And it's in, you know, soups, sliced meats, bread, actually, prepared chicken, takeout foods. So look for low salt. You know, make sure you're looking at the labels, and be careful when you eat out.
Yeah, I think I was just going to say a lot of restaurant foods, and not only are the portions so big, but
Right.
they tend to be salty. And we know salt enhances flavor.
Right.
It is a flavor enhancer, but again, it's that moderation. And then if, you know, I look at like portion control. So if you
Exactly.
can take some home, and I'm like not good at this, but if you can take some home, save it for your lunch the next day, you can eat out comfortably. And,
Right.
you know, it's just making those adjustments and just, I think, being aware.
Yeah, and most people were raised in this, you know, clean plate club, you know, as a child. So, and you get supersized me meals, and, you know, so it's important, as you said, I tell people to eat like they're at home. You don't have bread before your meal at home, for the most part.
Right, it's true.
And you have half the amount of a portion as you do in a restaurant.
I've heard you should eat on a smaller plate too, but I
Yes,
have
and
not.
colors too.
Yeah.
Orange makes you hungrier.
Oh,
Yeah.
okay.
Yeah, different colors and smaller plates are
Right.
very helpful.
And that is the old adage with McDonald's. Sorry to McDonald's here, but the yellow and the red are exciting colors.
That's
and
what I'm
it's
saying,
proven
yeah, exactly.
That it does make you want to eat and give that excitement to your meal. So we have talked about the signs of a heart attack. I just wanted to briefly talk about something. We talk a lot about health equity, and at the core of public health, that we need to pay attention to our most vulnerable populations.
Right.
In Nashua, we have about a 13% Latino and Hispanic population, about a 6% African American population. And the reality is that some of these populations are more affected by heart disease. So I'll start with hypertension, because it is a risk factor for heart disease. That 59% of Black adults have hypertension. And it's the highest prevalence among all racial and ethnic groups. So, you know, whether that's lack of medical care or whatever the case may be, we want to be able to pay attention
Right.
to those, to hypertension. You know, to know your numbers, know your
Exactly.
your numbers. And 4 out of 5 Asian adults undergoing treatment still deal with unmanaged hypertension. And that's a really high number. And this number just lowers a bit for Hispanic and Black adults, so 3 out of 4 for each group. So it's that unmanaged hypertension.
Right, and it's like I was saying, about 50% of people don't even know
that they have
high
it.
blood pressure.
Right.
Exactly.
And it is actually, coincidentally, one of our big campaigns through our community health improvement plan is hypertension. Through our chronic disease work group, we're looking at hypertension and how can we really pay more attention to that. We know that when you go to the doctor, you know, usually if you go to your primary care doctor before they come to see you, they're looking at, they should be measuring their blood pressure. If you have something that's a little bit higher, you can take your blood pressure at the drugstore, or you can hopefully get a cuff.
Right.
And do that at home. So that
Exactly.
home monitoring is really helpful.
And now they have these apps that you can use. So they make it sort of,
You can track.
you can track it, and it makes it more exciting. And,
Yeah.
some people are interested in that.
Yeah, I cannot use one more app. And then let's see.
And the one thing about socioeconomics too is that one of the biggest problems is people who are indigent. The food they get is just
Right.
is terrible. They can't afford the chicken breasts and the the high quality produce. So it's a big problem.
Right, and we just went to a food summit up in Concord, and we talked about food equity, but we talked about nutrition equity, and that's so important. The fresh fruits and vegetables being available for everybody, and we do have some programs. They're actually going up to the legislature right now for the farmers market to get like double the food, double your value if you're having like EBT benefits, for example.
I see.
So those are, a great way to have people take advantage of those benefits and also get more nutritious food into their diets.
Yeah, because maybe you can explain, but it seems like I get patients who, you ask them to not eat soups or canned things, and they go to food banks, and that's all they have.
That's what they have, right?
Yeah.
So we're working, again, part of this movement is to work with the food banks, to work with places that are giving out food. We do have mobile pantries in Nashua, and they give out fresh produce.
Oh, okay.
And then we have Grow Nashua, which helps people not only grow their own food, but they also have farm stands as well in the summer to
that's
give away some
wonderful.
of that food. And the soup kitchen here has a garden outside too as well. So we're getting the word out, trying to get that nutrition equity. We're going to run out of time, so I'm going to wrap up. Any last tips for our?
Yeah, I guess I would say that one of the other big cardiac problem one disease that we see a lot of is atrial fibrillation. So people and that's very common in elderly people, and irregular heartbeat. It's very important to know that if you have an irregular heartbeat, speak to your doctor.
And is that where you use the pacemaker to treat that?
No,
or?
it's more, it's treated with blood thinners a lot of the
Okay.
time. So it's important because it's a risk factor for stroke, like we spoke about.
Oh, okay. So there's a lot going on. We could probably talk for another half an hour, but
Sure.
our lights are flashing.
Good.
So I want to thank you so much for sharing this information with us. It's so
Anytime.
important.
Sure.
The good resources. The American Heart Association has a lot of good resources. I'm
Yeah, the
sure
American Heart Association, there's also a site called CardioSource,
Okay, CardioSource.
which is very helpful.
Okay. Yeah, so if you want to do some more research, that's a great, easy way to really find out, are you at risk? What can you do? There are probably diets up on these websites as well.
And know your numbers.
And know your numbers. As a matter of fact, so we actually are doing a campaign, so just great segue. Thank you, Dr. Hayes. We do talk about, is your blood sugar over 100? Know your number, know your diabetes risk, and visit your provider. We have some billboards around town. And then we talk about, is your blood pressure over 120, over 80? Know your number, know your risk, visit your provider. And that was a big effort to get people to go back to their provider.
And learn CPR if you can.
And learn CPR if you can. And then finally, I want to remind everyone that we have an immunization clinic at Public Health on Tuesdays from 4 to 7 and on Fridays from 9 to 12 p.m. We also have a sexual wellness clinic from 3 to 6 p.m. on Thursdays. And on those immunization days, we also offer lead testing. So again, thank you for joining us. And remember, public health matters.